Hello and welcome to Medical BuzzFeed, MedBuzzFeed for short. I'm your host, JT Maticus. We're here to bring you medical news from around the world every week, so please click subscribe. Oh boy, when you thought you were sick of hearing about COVID-19, the coronavirus, 24 hours, 7 days a week, well, WHO, WHO, the World Health Organization, is warning of another Ebola outbreak in West Africa. Let's hope this outbreak is controlled and stopped before it becomes a pandemic. Here is JT Maticus' alter ego, Future Doc House, to talk more about Ebola and why there seems to be an outbreak every so often, every few years. Future Doc House, take it away. Thanks, JT. Finally, we can talk about something other than the coronavirus. Ebola! Well, Ebola, like the coronavirus, came probably from an infected animal. And the DRC, Democratic Republic of Congo, is the current location of the outbreak. It is a virus that causes hemorrhagic fever. And like the coronavirus, symptoms can show up to a week or two later after contracting the virus. Unfortunately, there is a high risk of death from the virus, but fortunately there are vaccines and treatment options such as blood plasma donated by survivors of Ebola that can help control and cure the outbreak. As for why there seems to be an outbreak every few years, well, most likely it is because of the virus's ability to infect other primates. And again, like coronavirus, bats may also be the reservoir for this virus. Back to you, JT. Thank you, Future Doc House, for that gloomy insight. Corona, Ebola, and hurricanes. Oh my. The hurricane season has begun with tropical storms already forming and hitting the United States. With these rains and added moisture, mosquitoes can breed in large numbers. Here is Future Doc House to provide a laundry list of medical jargon of the diseases transmitted by mosquitoes. Future Doc House? Thanks, JT. Yes, mosquitoes. Mosquito season is here, and here is the list. West Nile, Zika virus, dengue fever, malaria, Chikungunya, Filariasis, Tularemia, Japanese encephalitis, St. Louis encephalitis, Western equine encephalitis, lacrosse encephalitis, Ross River fever, Barma forest fever, yellow fever, Keystonevirus, Rift Valley fever, and, to much surprise, HIV and AIDS is not, I repeat, is not transmitted by mosquitoes, even though it can be transmitted through blood. Interesting fact. Back to you, JT. Thank you, Future Doc House, for that list. Hopefully we won't have to report on any one of those diseases in the near future. On to viral news. Americans are gargling with bleach. Yes, bleach. I didn't read that wrong. To prevent the coronavirus. Here's Future Doc House to tell people not to do this and why. Again, JT, we need to find another guest for you to report this segment. Well, can't believe I'm going to say this. People, please do not gargle bleach. Bleach is chlorine, and chlorine in high concentration. It's not good for you. It's bad for you. Yes, yes, I know where you're going. I know we swim in swimming pools with chlorine in it. But that concentration is low. It cannot harm you. It cannot hurt you or send you to the hospital. And you're not swallowing swimming pool water, I hope. If you must gargle something, gargle mouthwash, gargle vodka, or soda. Even if gargling these will not help prevent the coronavirus, it at least is safe and won't send you to the hospital. back to you, JT.
Thank you, Future Doc House, for that public service announcement. On to the last word. The word is an organism. It's always changing. Some years we will have outbreaks of diseases and even a pandemic. Other years we will see fires, droughts, floods, and other catastrophes. There are earthquakes, volcanic eruptions, tsunamis, and typhoons, but we are the human race, and we've survived in this ever-changing world for thousands of years. Let's continue to work together as one race, the human race, so we may live and exist for thousands of years to come. And that's the last word for now. Stay healthy and stay safe. Ciao.